Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Payne, Chief Medical Officer and founder of Atlantic Coast Aesthetics. And Dr. Payne, this question of the week comes from the Facebook crowd. And this gentleman wants to know, he's looking for an extended tummy tuck and lipo, kind of wants to know the cost and range on these procedures. Dr. Payne, what would you suggest?
Well, it's a great question. We don't talk about it too much in terms of the cost of the procedures. What's an appropriate price? People can essentially do searching around and so forth, and there are a lot of variables that go into what a price is going to be for a different procedure. Talking about, let's say, a basic tummy tuck. I know we're talking about an extended here is the specific question, but let's say a standard tummy tuck. Our region, South Florida, fairly competitive. There's a lot of surgeons around. An average price range for a basic tummy tuck is probably going to be something in the mid 6,000 range. It's often a little lower than that, depending on where you go and how much it needs to be done, and if there's any other procedures being done at the same time. If you talk about an extended tummy tuck, it's going to be a little bit higher. Now, when you get quoted prices in different places, if you get real low pricing, super low, it almost makes you question whether are they not telling you all the costs. Sometimes they won't quote you the anesthesia or the facility. Some of those places where you get super low prices, the surgeon may not even be doing the operation. It's hard to say. It's something that's not nice to say, but it's true. You have to be careful about the place. They're not going to tell you this. Usually you can kind of figure it out if you're at some place that really is a little questionable. On the other hand, if you're getting quoted the price of, a decent used car for what sounds like a basic tummy tuck, there's usually one of a couple things going on. One, you could be in a very high cost city, and you'll know what those cities are. They have very high overheads of handling what they're doing, so that naturally they have to charge quite a bit. Maybe the person is truly real famous or real good. They often aren't, but they might want you to think they are. So that's another thing that can lead to a real high cost. In our situation, we actually try to keep the prices in a mid-range for a different reason. We want to make sure we can do these surgeries affordably so that we're doing a lot of them. And by doing a lot of them, we like to say the complication rates for all of our procedures that we offer in our practice, I can tell you for a fact, are a small fraction of that being published. And by that, I tend to mean, 10% or 5% of the published rates. For that reason, you have to watch a little bit that if someone is doing it at a real high cost and if it's not being done at the volume, you never know. So I can't speak about specific costs because they're kind of all over the map and for different factors, but there's going to be a range for whatever city you are in that is going to take into account to a certain degree the overhead, and in general, the background and experience of the surgeon, how busy their practice is, and a couple of other factors like that. So it's a kind of a broad overview. I can't give specific numbers, but that should get you started to kind of do some research and figure out what an appropriate price is being charged and whether that's something that you're comfortable with.
Well, thank you, Dr. Payne. And if you have a question for the doctor, please visit our Facebook page, website, Instagram, or Twitter. And Dr. Payne, we appreciate your time, and we'll see you on the next question.
Great.